Welcome to Almost Here, Round the Corner Future Technology podcast with Richard Jacobs. Future technologies poised to transform our lives for better or worse are the focus of this podcast. Almost here means these technologies are now here and starting to be used, or just around the corner, from Bitcoin to artificial intelligence, 3D printing, blockchain, virtual reality, and more.
Hello, this is Richard Jacobs with the Future Tech and Future Tech Health podcast. I have Steve Griffiths. He's a PhD and Senior Vice President and COO of Optum Health. And the website is optum.com. So, Steve, thank you for coming.
Happy to be here. Thank you.
Yeah. Well, tell me the premise of Optum Health. What's the goal of the company?
So actually, it's Optum. Optum Health is one of the parts of Optum, but okay. Optum is basically a health services company. It's one of the companies within United Health Group, UHG, and United Health Group has two main parts: United Health Care, which is the insurance businesses, and then Optum. Optum has three main parts to it. One is Optum Health, which has health and health management programs like diabetes and wellness programs. We have Optum Rx, which is a pharmacy healthcare services organization, and then Optum Insight, which is a data and analytics organization. Collectively, it's I think number 6 on the Fortune 500 in total, and everything we do is sort of focused on making the health system work better for everybody.
Okay. And instead of getting into the policy side and Obamacare and Trump care and all that stuff, how about the tech side? What's the latest and greatest, or what are some of the new innovations that Optum is using to improve things?
Yeah, so it's obviously a fascinating and interesting time with everything that's going on in technology and analytics, with in the advent of sort of emerging technology. As we think about Optum's businesses, there's sort of 4 main focus areas. One is, again, population health management, healthcare operations, pharmacy care services, and healthcare delivery. As I mentioned, data and analytics sits really at the center of all of that. We actually call that Optum IQ. Because it's really the intelligence that we drive through all of our businesses through the use of data, analytics, and expertise, all supported by technology. So it's an exciting time, as you know, and everybody knows, with the advent, at least in healthcare, of AI. Of course, healthcare is a bit of a slower adopter, but we're doing a lot of machine learning, deep learning models in a number of areas, and certainly happy to talk a bit about that. And then we also actually did a first, for us anyway, survey of over 500 healthcare executives around AI as a topic, just to sort of see where the industry is. So happy to share some insights on that too, if interested.
Yeah, let's talk about the survey first. I wonder what the perception of healthcare executives is right now, and is it different from what you thought? Yeah,
I think it's pretty consistent. I think basically pretty much everybody's optimistic about AI. I think close to 95% of the respondents, and these were big organizations in multiple different sectors, so health systems, employers, health plans, et cetera. But as I mentioned, about 95% sort of agree that AI is probably one of the key paths toward broader accessibility and affordability within healthcare, and probably I think it was 3/4 of them have or are developing a strategy around this. Most believe that this is going to lead to ROI, through any number of applications. And I think the number was over the next 5 years, the average sort of AI investment was going to be about $32 million, at least across that cohort. I think ROI, sort of the timing on the ROI, is a question for these organizations in terms of how big do they go in their investments and partnerships and technology. Many thinking they probably won't see an ROI from probably over 4 years in total. And then I think the other thing that came out of it, which isn't really a surprise because we're dealing with it as well as I think most organizations who are transitioning into the space, is talent. If you look at the talent pool, both on the technology and the analytics side, it's already stressed, if you will, from moving from more of a, let's say, health plan orientation, which is where my own background is, and many of the folks with whom I work, those organizations use technology and analytics and data to manage risk and the health of populations. Now we're seeing provider organizations get into that by taking on risk from the government and from health plans, this whole thing called, value-based care. Well, they don't have actuaries and health economists and data scientists to help them think and do things that health plans have traditionally done. So that sort of began to tax, the market for talent. And then just apart from that, just data science in general, all things AI, as everybody figures out what their strategy is in that space, talent really becomes a big issue. And it's how do you look at the talent you have internally and maybe evolve their skills into some of these newer capabilities, as well as acquire folks externally with sort of the PhDs in computer science, or seeing formal data science programs being stood up in any number of institutions. So anyway, those were sort of the main themes of how the market is thinking about this space.
Well, you guys would be in a good position to do some AI and machine learning stuff, because the data sets you guys have on insurance, I'm sure you have hundreds of thousands or millions in different cohorts. So, again, you have the data. It would be ideal for you to use it. So what particulars are you looking at? I don't know how far the implementation is, but have you seen any AI? Is it in play for you, and what's it doing? What's it changing?
Yeah, there's a lot of different areas that we're focusing on. Very applied spaces. We always use the word AI with an ROI. We're a very financially driven organization, as you can well imagine. So as we think about capital investments, we focus very intently on where we're driving value, and that value could be improving cost, whether medical, pharmacy, behavioral spend, could be efficiency in operating costs, driving quality improvement, all those things. So we take a very disciplined approach. But there's probably some different categories of application of these technologies. There's sort of, the clinical, let's say, predictive models, identifying diabetics sooner, identifying people that may have a high probability of an opioid use disorder. So things sort of, heart failure is another one, imputing risk or presence of a condition when maybe the physician's notes don't specifically indicate that. And one example being, we partnered with WestMed, which is a large health system, and actually used AI on their data to basically identify undiagnosed people with atrial fibrillation. AFib, as you probably know, is something that is very sporadic. So, your heart can go into fibrillation, flutter or whatever, but it's very episodic. It doesn't continue. So when you go to the doctor, you may not have a symptom, but it's important that you treat it, because you can have a stroke and a blood clot, those types of things. And so we actually trained some models on in a pilot proof of concept with their data, and identified, I think, 70% or something of the patients who had AFib, even if they weren't diagnosed for it. So that really sort of was an exciting initial finding, because it helps become an input into the kind of the care delivery process. A lot of people get worried around, suddenly AI is going to be making decisions, in healthcare. I think that's a very, very long way away. We see an exciting way to enable decisions.
Quick question here. So when you said you were able to identify, for instance, atrial fibrillation in a population, was it that you reached out to the doctors and said, hey, we're going to incentivize you to get the patients to collect certain data you're not getting right now and report it to us? Or how did you figure that out?
Yeah. No, so it was actually using their own electronic medical record information that they enabled us to build models on with them. So it basically looked at the characteristics and the features in the data, and the training data set and sort of the usual way of building model. It identified basically individuals who had a high probability of a diagnosis, even though they didn't have a recorded diagnosis for AFib. And so then basically patient lists were provided, to those physicians in the pilot to basically reach out and make sure that those patients were getting the services that they needed.
Well, would that be an additional potential path where, again, you partner with X number of doctors, let's say for diabetes care, and the doctors say, all right, Optum or United Healthcare, for instance, has said you'll get a lowered premium if you report your blood sugar readings 3 times a day to us for a period of 6 months for use in a study.
Yeah, I haven't seen that particular sort of program, but I think that's something that I could envision that an organization would do. It's all in the it's all in the data, right? And so this whole concept of big data, having lots of data and lots of different types of data. This not just claim data, but also electronic health record and consumer data and social determinants information, because obviously things like social isolation and health literacy matter in all these equations. And so, I wouldn't be surprised if some organizations had incentives like that to capture information.
Yeah, because I don't want to say there's only so much you could figure out from electronic health records. I'm sure there's tons.
Right.
But to take that further and to go further along that path, I would think it would be very exciting for you guys that you've been able to figure out, we can tell when someone's going to have, this condition.
Yeah.
So let's take it further now and partner and get a lot more data, which will really inform what you guys do, how you price premiums, how you provide care, and just everything. It'll help.
Yeah, and just to be clear on the Optum side, we don't do insurance, and it's a highly regulated space in terms of how the actuaries do it. So we don't, the data aren't used, in those sort of premium situations for that. But in terms of identifying people with conditions and that sort of a stuff thing, it's these different types of data coming together to create a whole profile. I think the other sort of area clearly is, in operations, looking at very manual processes where decisions happen. Sometimes the processes are slow, and using some of these models to support, the decision making, whether it's around prior authorization or other types of medical chart reviews. Using the technology just speeds things up and helps people get the care that they need faster, and makes the overall system more affordable, which is what everybody needs.
Yeah. So what areas specifically have you guys identified that need the most help that you're already working on or you're planning to work in?
Yeah, I think, sort of the disease identification, as I already talked about, is certainly an interesting and important area. It has lots of applications across multiple different markets, both in, as an example from an Optum perspective, in software that we sell to help health systems and payers support their business processes. But also we have in Optum Health many clinical programs like diabetes, oncology, those types of things. And so powering those to be more intelligent, this gets back to the Optum IQ concept, the intelligence inside, providing more and improved models to support the interventions that they provide. So a lot in that space. And then again, looking for use cases in the operations space. Around efficiency. We also have done some work using deep learning models to read medical charts to help speed up some of the physician and nurse reviews of medical data, where it often takes them a long time to. It's very laborious, and lots of errors sometimes can occur when people have to sort of sort through charts. And so using AI to model those decisions in a supportive role speeds up the whole process and reduces waste, quite frankly.
So any use cases that were really surprising or cool or insightful to you that you've seen recently?
Yeah, there was one recently, actually was sort of in the kind of identity matching space where, lots of people come into organizations through different portals and different ways. And sometimes they can come through as John Doe, John Doe. In another case, they might come through as John Doe, Jon Doe, or J Doe, or Job Doe if something was miskeyed, and obviously understanding and making sure that people who they say they are is extremely important, and a team built a model to help. It was a very manual process to try to ensure that records were lined up the right way, and so using AI again in a supportive role to basically speed up that process there's, as you know, humans can only go so fast. And so there were throughput issues, and there were millions of records in this one particular use case that needed to be reviewed. And of course, AI can just tear through it and find actually things that the humans couldn't, or where a mistake was made. So that was one. I've been in analytics for 20 plus years, using technology as a part of that, and that was one where I was like, I never would have thought of that. So it's a really fun time as you sort of see these use cases come up in areas that you just really wouldn't have thought about before.
Well, what about the sharing of data? I mean, I think we've all had the experience where we'll go to a hospital, we'll go to a provider, we're still filling stuff out on paper. You got to write the same thing 5 times.
Mm-hmm.
If you go to a hospital, you got to explain your situation 10 times. I mean, why can't that be shared so that you don't have to do that and everything's a lot faster?
Yeah, I think workflow, capturing of information, and which gets to just integration and interoperability, I think is a huge issue. And so I think making to your point, like only having to gather information one time and making it available in multiple other places, so it doesn't have to be recaptured. I think that's those are clearly areas of opportunity.
So what are some of the big watersheds that we're going to see happening in the next 5 years, you think, in terms of what you guys are working on?
Yeah, I think, again, I think in this clinical space, and as we think about the cloud and all that that offers in terms of how we make information and analytics available in a very, in a safe way, I think there's going to be advances there. I think, as I mentioned, in the service offerings and the clinical programs, the pharmacy programs that we offer, I think there's going to be, a lot of advancement around clinical prediction and even progression of disease. So, there's a lot of predictive models out there that focus on, predicting future costs or utilization, fairly generic predictive models. I think we need to get much more, you've seen the Gartner sort of curve move toward prescriptive analytics, get more specific around people that are, pre-diabetics or people that are pre-heart failure, and beginning to look at how people are progressing through conditions. So not just are you at risk for having a condition, but now that you have it, how are you progressing through that? And how do we continue to evolve interventions and work with our clients, in health systems and health plans to provide better and more specific interventions to where people are in their health kind of care journey. I think we're going to see a lot of advancement in that space.
Okay, what about the pharmaceutical side of it? You mentioned that.
Yeah, I think similar things there as well. Both, just as I mentioned, sort of prior authorization is an area where you have complex or expensive drugs that need to be reviewed by pharmacists, et cetera. So I think using AI-based technology to help speed that process up, I think, which again helps people get what their drugs and what they need more quickly. I think that'll be an area where we'll probably see some advancement. And then similarly, within the pharmacy space, we have things like specialty medications and specialty programs for multiple sclerosis, for rheumatoid arthritis. These are individuals on very, very expensive medications who have many different needs. And so again, I think using these types of models to help manage the care, the quality, help make closing gaps in care for those populations and managing overall expense in a helpful sort of way. I think we'll see more and more models being built increasingly for that space.
Okay, very good. Any trends you see emerging in the industry in general that you haven't talked about?
I think. Let me just think here. I think we talked about talent. I think that's there's sort of I don't know if it's a trend, but I think it's a sort of something that's becoming more of an issue or something we've got to deal with. I think we're really seeing data and analytics, and again, having been in it for quite a while, it's really becoming really more of seen as a strategic asset in organizations. And I think the AI survey that I shared sort of, I think further supports that. I recall in previous roles, trying to be a champion for analytics, for what it could do, and there's sort of an organic nature to organizations. They change when they're ready to change, and sometimes they change when the market changes, and they have to react to it. And so even if you think that analytics are a great idea, they may not be ready for it at that time. So I think we're seeing a trend of organizations all looking at this space and understanding that they need to think about it differently, and that in some ways there is a race here competitively in certain areas. And so I think that trend of awareness of the importance of data, of analytics, of the expertise, again, as we think of this sort of Optum IQ concept, is I think many organizations are dealing with that in a way and thinking about it in a way that they haven't historically.
Yeah, I always seem to focus on United States type stuff because that's where I am. But what about worldwide? You guys look worldwide, and what's the picture look like there? Are there certain nations that are doing different things versus the United States that are interesting?
Yeah. So to be honest, I don't have a very large international perspective. I know United Health Group is doing work in a number of different companies and or a number of different countries. And we're working hard to make sure that we show that our capabilities work here, so that as we do go externally, we have proven solutions. But I don't have, unfortunately, too much perspective on kind of where some other countries are relative to AI.
Right, no worries. Okay. So what's the best way to for people to get in touch and ask questions and find out more?
Yeah, I think I'm happy to share my email address. Would love to talk to folks about their experience and answer further questions around it. I can, happy to give you that offline here. I think it's really an exciting time. I sort of refer to it as the time of the nerds. I mean, obviously there's a lot of change in technology, but back to that talent conversation, it's a fun time in healthcare, in analytics. The new methods and new technologies and capabilities are really enabling us to do things that we just haven't been able to do before. And of course, people talk a lot about the hype of AI. There are really a lot of very meaningful use cases that I think are really going to make a difference from an affordability perspective and access perspective and quality of care. So it's exciting, and happy to talk to anybody about it.
Okay, very good. And folks can also go to optum.com as well. So, Steve, thanks for coming on the call. I appreciate it.
All right. Thank you. Have a great day.
You have been listening to Almost Here, Around the Corner Future Technology podcast with Richard Jacobs. Subscribe to this podcast, post a review to discover more future technologies that are poised to transform our lives for better or worse, such as Bitcoin, artificial intelligence, 3D printing, blockchain, virtual reality, and more.